Knock, knock, knock. Providing privacy. Hi, my name is Marina. I'm a nursing student at Southwest Tech. Today I have doctor's orders to do a sterile technique dressing change. Can you verify your name and date of birth? Great, that matches up with what's on your wristband. And any allergies? Okay, perfect. So I'm gonna go ahead and wash my hands with soap and water and get some gloves on. Okay, and so I was in here about 30 minutes ago and gave you some pain medicine. Since your pain was at about a 9, what would you rate your pain at now? Okay, perfect. And is that manageable then? Alright, so we'll go ahead and do the dressing change. Just going to go ahead and expose the area of the wound. And then I'm going to use the push-pull method and remove the dressing. Alright. And now I'm just going to remove my gloves and I'll go ahead and wash my hands with soap and water, and then we'll go ahead and get that cleaned up for you. Alright, so now I'm going to set up the sterile field. So I'm going to do the drape first. And I've got the bed and the table both at height, my waist height, so that I don't have to go below my waist. I'm just grabbing the 1-inch border here, not letting it go below my waist. Alright, and now I'm going to go ahead and open up the bowl. And the instrument. And then all of my packages are closed and sterile, so they're ready to be used. My saline is normal saline. The expiration is in 2020. Normal saline expiration is in 2020, and normal saline expiration is in 2020. So I'm going to go ahead and open up my packages then. To go ahead and lip my saline since it's already opened. And I'm going to have my hand over the label so that it prevents from any ink dripping in there. Alright. And then I sanitized the bedside table beforehand, and then I'm going to go ahead and just put some tape onto the side of the table. Alright, and then I'm just going to go ahead and wash my hands with soap and water one more time before I put my gloves on, just to be sure that I'm nice and sterile. Alright. I'm going to get my gloves on here. Okay, so that is all good to go. Okay, so now that I have my sterile gloves on, I can kind of arrange this stuff a little bit. I'm going to go ahead and put these gauze in the bowl there. Okay, so now I'm going to go ahead and sacrifice this hand and wash off the area of the wound. one more time from the outside around. And then I'm just gonna assess his wound. It looks like it's healing well. It's got a nice pink color, and no pus or any signs of infection or anything like that, so it all looks good. I'm gonna go ahead and get rid of these. And then this hand is now contaminated, so I can't use that, so I'm gonna go ahead and use this hand to grab and put on his clean dressing. And then we are done with the sterile procedure. So now I can go ahead and put his tape on there. And then cover him back up. Is there anything else I can do for you today then? Okay, great, thank you so much. And then the 9 techniques are the 1-inch border, do not turn your back to a sterile field, fluid flows in the direction of gravity, sterile garb is required to touch anything in the sterile field, honesty, skin is not sterile, nothing below the waist is sterile, and once it's wet it is not sterile, and I'm forgetting one. What is the other one? Oh, and limit the time the sterile field is open. So that concludes the skill